to Health Matters Today. I am your anchor Utabi Archibald. This is a program where we handle various health challenges and chart a way forward towards bringing solutions to every health problem. I am not doing this alone because I have with me in the studio Dr. Omorin, a senior registrar, Community Medicine Department from the University of Uyo Teaching Hospital. And today we'll be discussing on the topic HIV and AIDS. Dr. Omorin will let you know everything you must know about HIV and AIDS. It's been there, but it seems forgotten. So many persons seem to have forgotten about this menace, but it is very much around. That's why we deem it fit to ensure that you know what you should know about HIV, how to prevent it, and probably you're a victim, what to do to live long and maintain your normal health. You're welcome to our program today, Dr. Morin.
Thank you very much.
Please say hi to the viewers.
Hello everyone. Happy to be here.
You're welcome to our studio. Good to have you. Dr. Omorin, today, like I said while I was introducing the program, we are handling HIV AIDS. So many persons already know about it, or they may have layman's knowledge about it, but why we brought you to the studio is to let them know the everything anybody should know about HIV and AIDS. It's been there, but for some years they've not really been news about HIV AIDS. So what should people know about HIV? What is it about? The dangers involved in it. You're welcome, sir, to the program.
Alright, thank you very much, Utibe. Actually, HIV/AIDS still remains a very vital issue to discuss. We can never get tired of talking about it, and to show you how important it is, so much money is being invested in trying to control this problem globally. So, in a simple way, I'd just like to say that HIV infection is actually caused by a virus, the human immunodeficiency virus, which is actually an unusual virus because what it does, it doesn't cause a disease on its own, but rather it targets certain cells that offer protection in the body. We actually call them T cells. Okay. In fact, if I was going to be more specific, we refer to them as CD4 cells.
CD4
yes.
cells.
So the virus actually targets these cells, and when the virus targets these cells and starts to replicate, increase, it starts to destroy these cells.
Doctor, let me interrupt you. These CD4 cells,
yes,
what do they do to the body?
No, they are actually forms of T cells, which are white blood cells, which protect against infection, generally. So the virus actually focuses on these cells, reduces the numbers of these cells in the system and predisposes the person to all sorts of other infections which we call opportunistic infections. I think the number one you'll be talking about is tuberculosis, and various others. So
a victim with patients with HIV does not just end up with HIV. There are other,
of course, even there are even cancers that they are also at risk of getting. So there are various infections and even some cancers as well.
Okay, doctor, what are the possible signs or symptoms that a victim you can see, a pointer that you see and knows that this person is actually HIV positive?
Okay, well, it's very important to note that most of the cases, of course, are the initial exposure when the infection comes in, and that's why we encourage people to really actively try to test themselves, because at the initial phase, most of the time, there's just a short period of maybe a few weeks, maybe 1 to 2 weeks, where the person may just have a few non-specific symptoms. The kind of symptoms you have, a lot of people will just feel that they have malaria. And then those basic fever, maybe
Headache.
weakness, body pains may just phase out, and then the person has a long period we call a chronic latent period. So the person can be symptomless for so many years, and then as those so many years pass by, the person now starts getting to the point where his immunity has dropped so much, and then some other more severe symptoms start manifesting, like maybe he's passing watery stool regularly and having fever for long.
Doctor, before these more severe symptoms start manifesting,
yes,
at that point where that victim is having, let's say, is coughing or other minor symptoms,
yes, minor symptoms,
don't you think the person should visit a doctor
or
get tested to know what treatment to take?
Yes, a lot of people, actually a lot of people, when they have these initial symptoms, they may be thinking of something else.
Like malaria, which you
yes,
mentioned
but that's why, a lot of health workers now are conscious of something called, active case finding. So most of the times, the responsibility falls on us to suspect, have that high level of suspicion, and actually test them. Of course, some of them know that they have high risk behaviors, things that will predispose them to have HIV. So some of them already know that, okay, I have to do this test.
Okay, doctor, what are these things, the factors that can predispose one to HIV/AIDS?
Okay, so like I just said few seconds ago, it's actually more or less a behavioral thing. So you have to first consider the person's sexual behavior. So people with risky sexual behavior, maybe people with multiple sexual partners, people engaging in unprotected sex. You also have people who actually are called injection drug users, people who inject themselves and share those needles with others. You also have what we call mother-to-child transmission. So if a woman already is HIV positive and she doesn't actually pay attention to that, doesn't try to seek treatment, already she's likely going to pass it on to her unborn child, either through the pregnancy or through the delivery or even during breastfeeding. So, and then of course you can talk about other means like blood transfusion, which are not very common.
So if a pregnant mother is treated, who is infected with HIV, and she gets treated on time, there's every likelihood that the baby will live. The baby can come out without being infected.
Of course, we call it prevention of mother-to-child transmission. If the mother is very serious with her medications, she's tested, she's confirmed, she starts her treatment on time, there's what we call viral suppression. So viral suppression means that you are very adherent with the drugs. You take the drugs very seriously to the point that the virus is almost undetectable in the blood. So yes, it's possible the mother can actually prevent her child from getting it.
You've answered my next question, because I wanted to ask you how people get infected, the mode of transmission, which you have mentioned, sexual intercourse, having multiple sexual partners and other things. Doctor, what would you have to say about, let me say, women who go to the salon to make their hair, and unknown to them they come back being infected? They may not even know where they got this thing. What do you have to say about that?
Well, what I'm aware of is that most of the things that will put women at risk